Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Today, I want to talk to you about getting the most out of your emergency department experience. Before I get into my 4 key points, I just want to mention that I want to acknowledge that I do not feel like it should fall to the responsibility of the patient to manage your emergency department experience. It would be phenomenal if you could just be the sick or injured person that shows up to the hospital and is, just focused on yourself the way you feel, and you just get all of the care and treatment that you deserve. However, here in the real world, I think we all know that that's just not the way it works. I'm willing to bet that either you yourself have had a poor experience in the emergency department, or you know somebody who has. And like I said, it shouldn't fall on the responsibility of the patient to manage that experience to get the most out of it. But unfortunately, it does. So that's why we're here to talk about some techniques to get the most out of that experience. And I also want to say that you can do all of these things and, quote, do everything right, and unfortunately still have a poor experience. There's, of course, a lot of issues in healthcare, and there's a lot of them that are amplified in the emergency department. So I just wanted to acknowledge that. And if you're feeling that way, even, coming to this video right now, you're 100% valid. So moving forward, let's talk about what can you do to try to optimize that experience. So the first thing to do to get the most out of your emergency department experience is to determine if you actually need to be in the emergency department. Oftentimes the ER tends to be kind of a catch-all access point for healthcare, at least here in the US. And that causes a lot of problems, both for the providers and for the patients. So the first thing I can think of is, I think we've all either dealt with, or again, known somebody who has dealt with extended wait times in the ER, waiting 8, 12 hours, sometimes before you're even seeing a provider. I know there are so many people who come to the emergency department and then just leave because they can't get seen in a timely manner. So one thing that we can all do to help avoid some of that is to really try our best to only utilize the emergency department for truly emergent conditions. There are a lot of things, I should have looked up a stat, but I want to estimate probably close to 50% of patients who come through the emergency department on any given day are not having emergencies, which means, quote unquote, they don't need to be there. So you can imagine if you're dealing with twice the capacity that you actually need to be dealing with, how that can cause problems with the rate at which people are moving through, and then how divided up the care is. Because at the end of the day, there's only so many doctors, there's only so many nurses, there's only so many rooms, there's only so many respiratory or, CAT scan tables, x-ray, all of those things are a very limited capacity. So when they are being spread amongst people who could be served in another less emergent location, it makes the experience worse for everybody. So knowing when to go to the ER is your first step at getting a good experience. So After this video, I will be sharing an infographic about kind of the difference between what's an emergency, what's urgent, what can go to primary care, and what you can call utilize a teledoc for, which often can help fill the gap since primary care is difficult to get into, and of course specialists are even worse. But things that should go to the emergency department are chest pain, shortness of breath, uncontrolled bleeding, uncontrolled vomiting for a prolonged period of time, not just you vomit 3 times in an hour. This is by no means an all-inclusive list. Or a bad break in a bone, any kind of head trauma, car accidents, all of those things, if left untreated, could be potentially life-threatening. So they should be addressed in an emergency setting. However, some things that are more appropriate for an urgent care or for primary care would be flu, cold, or COVID. Again, not to the point where you're having chest pain or shortness of breath, but if you're just running a fever and don't feel well and are just trying to get some medications to help with that, that's more appropriate for those locations. Or if you have a sprain or a bad bruise, a cut, not one that's going all the way down to the bone, but maybe it just needs a couple of stitches. Those sort of more minor things can be treated in locations outside of the emergency department. You'll wait less when you go to an urgent care, and oftentimes your bill is going to be less too. Another issue for when you do go to the emergency department with a non-emergent condition, unfortunately, you are likely to get, you can catch some attitude from the ER staff for that. Again, I'm not condoning this, and it's not the way that it should be, but you do have to understand on the other side of it is that your ER providers, not only are they trained and have the intention to treat emergency conditions, but they are doing that alongside of treating people with less urgent conditions. And as I mentioned before, when people are coming in with less, non-emergent conditions and taking up the time, resources, and the providers, then it means that those providers can't give all the care and attention that they could to these more emergent patients. And that gets really frustrating for the provider. And you can imagine if you're in a situation where you're having a life-threatening emergency, you want all the care and attention from those providers. And that's truly the people who are actively having a life-threatening event or at great risk for one, that is where the attention needs to be of those providers. So when attention and resources gets diverted to non-emergent things, the staff can get irritated just for you being there. Again, it's not fair. It shouldn't be that way, but that's why that happens. And that's another reason why if you can avoid going to the ER, that's probably your best bet. If you have determined that the emergency department is the right place for you to be, you want to be prepared. Now, this may sound funny because who prepares for an emergency? By its very nature, it's an unplanned event. However, you can prepare and know that at some point you will have an emergency. So being prepared now makes it easier when that time comes. So oftentimes people are usually aware that you should have your insurance and ID with you. It's probably in your wallet right now, but there's a few other things that you should consider bringing with you to the hospital. You definitely want to have a current medication list and a list of your medical history and surgeries and the physicians that are currently treating you. I do have a tool for this. I have the Health Hub. It's a one-sheet medical overview. If that's not something that you've downloaded yet, I'll share a link in the comments. It's right on the homepage of my website. Just scroll to the bottom and sign up for our email list, and that's the very first thing you'll get from me. It's a fillable PDF, so you can drop all that information in, save it to your phone, updated anytime, and you'll always have it with you. For the less tech savvy people, you can, of course, print it out and fill it out by hand with a pencil and change it as you need to. Keep it in your wallet. But either way, you'll be prepared to have all of that important information on hand. All your medical information is in your chart. And I hear this a lot of times. But what you need to understand about medical charts is that they are comprehensive and they are not intuitive. So particularly when you're in the emergency department, working with providers who often have a smaller window of time to interact with you than just your regular doctor does, if there's a piece of your medical history that is buried in a chart from a visit from a specialist, months or years ago, your ER providers are not going to find that information. You need to be prepared for it so that anything that is applicable to what's going on with you today, you can just readily share that information, and there's not time wasted or pieces of vital information that get left out. Never, never, never just assume it's in your chart. The next thing you want to do is just make sure you have some practical items packed. Again, going to the emergency department, a lot of times you are going to be dealing with extended wait times. Even if you're not spending time in the waiting room and you do get into a room right away, it's going to be a couple hours typically before, you're getting all this testing done and we're figuring out what's going wrong with you. And then if you do have to be admitted to the hospital, a lot of times you're waiting a while to get up to a hospital room. So keeping yourself entertained and comfortable during that period of time is going to be really to your best benefit. Certainly when you're in the emergency department, something is bringing you there that you're not feeling your best. And if you're just sitting on that awful stretcher with nothing to distract yourself from how miserable you're feeling, you're going to be feeling more miserable. So bring yourself a book that you're reading, your Kindle, your tablet. Know that you may or may not have good Wi-Fi or cell service, though, so maybe don't plan on streaming Netflix. A coloring book, if that's something that you like to do. I've seen many people bring their knitting or crocheting projects to help pass the time. So anything you can do to keep yourself entertained. Also, keeping comfortable. This is not the time to dress in your cutest clothes. Wear sweatpants and a t-shirt if you do have time to change before your emergency department and visit. And again, if time allows and your condition, perhaps freshening up or even getting a quick shower before you come. So if you are sitting there in the waiting room for 12 hours, getting testing for 6 hours, and you needed a shower before you even came, you're probably going to feel pretty uncomfortable by the time your emergency visit is done. Again, don't delay. If you're having a very urgent condition, don't delay just to get a shower. And we're not worried about if your legs are shaved or not, believe me. But just doing what you can to get yourself more comfortable before you get there. Also consider packing some snacks and drinks in your bag. Now, if you've been to the emergency department, you've probably been told during your visit that you can't have anything to eat or drink right now. And that's because anytime you're coming into the ER, one of our biggest concerns or questions is, does this patient have something going on that is going to require immediate emergent surgery? If the answer is yes to that question, and we've let you eat the whole time, now that surgery is going to be delayed, because when a patient gets anesthesia causes the entire body to relax way beyond yoga and meditation, to the point where your stomach contents can and will reflux up, and then you will likely breathe them in, because the protective mechanisms that you have normally in place do not exist when you're under anesthesia. That's why you can't have anything to eat or drink before surgery. And then, because we don't know if you have to go to surgery, that's why you can't have anything to eat or drink typically in the beginning of your emergency department evaluation. That being said, most people who do come into the ER don't ultimately go to surgery. So once some of your testing comes back, typically surgery can be ruled out and you can be allowed to eat or drink. You're probably going to have to ask for that. And then having that stuff on hand, you'll be able to get it right away, and you won't be relying on ER snacks, which suck usually. I mean, you're lucky if you can get graham crackers and a very dry turkey sandwich. So bring your own stuff, shelf stable. Don't bring anything refrigerated. Bring stuff that's easy on the stomach, and that you wouldn't mind eating no matter what time of day it is. So you've decided you need to go to the ER, and you've got your bag prepared. You're ready to go. When you get there, it's always important that you have your expectations managed for what that visit can and cannot accomplish for you. As I've mentioned before, the ER is not the gatekeeper of all treatment and diagnosis in healthcare. And it wouldn't make sense if it was. If you think about, if you've been to a specialist before, all of the crazy amounts of tests that they put you through to get you to a diagnosis and ultimately to treatment. If we try to implement those things in the ER, I mean, nothing would ever move through. We already have such a hard time moving through the patients that we are seeing that would absolutely bring the whole machine to a grinding halt. That is why that we do have specialists, and a lot of times why there is such an extended wait period to get into them. I wish there was enough providers and resources to go around for everybody to get things very quickly, but it's just not the case. And in the ER, we are equipped to screen and diagnose and treat life-threatening illnesses and injuries. So that being said, we are really good at seeing that you have a heart attack and taking care of that. If you are having difficulty breathing, we can help you with that. Strokes, bad traumas, broken bones, all those kinds of very immediate life-threatening conditions. The other side of that is we are not good at treating obscure things, particularly rare disease. If you are somebody who suffers from rare disease, the most important thing you can do for yourself is to be very active with your specialist and try very hard to keep yourself out of a flare-up and to keep your disease managed, because 9 times out of 10, it's not going to be managed appropriately in the ER. And that makes sense. I mean, emergency providers are trained, again, for those life-threatening emergencies. They are not familiar with the treatment protocol for every kind of disease under the sun. There's a phrase in emergency medicine called when you hear hoofbeats, think horses, not zebras. And what that means is the majority of the time, or a lot of times, another one is if it walks like a duck and talks like a duck, it's a duck. And for, the majority of people who come through, that applies. But for people with rare diseases, you're going to have symptoms that present that don't fit the typical clinical picture. And it also means that you're going to have those people still have emergencies, and having the emergency with the chronic rare disease oftentimes will be complicating and overlapping. And unfortunately, you're probably not going to have a good time. I really wish that ER culture was better about this. I've seen many times over, someone comes in with a rare disease that clearly the emergency staff is not familiar with, not educated in. And instead of listening to the patient, often the patient gets brushed off simply because what they're saying doesn't fit in line with, what the doctor knows. And it's really frustrating, and I wish it wasn't that way. So, of course, everybody should do their best to manage their medical conditions and stay out of the ER. But for those with rare diseases, it's even more imperative for you to be very proactive about your health and try to minimize your emergency visits as much as possible. And knowing ahead of time that probably will be a barrier. I don't have a good solution to that. I really wish I did. Sometimes it can be helpful to bring some information kind of about the overview of your rare disease. The specialist who manages it, having their name and phone number right there can also be helpful. But again, it's something that we as ER providers just really suck at. That being said, this rolls right into my last point of effective communication. Again, this should not be the responsibility of the patient, but the fact of the matter, it is. When you are in the emergency department dealing with those emergency providers, their time tends to be even more limited than when you're dealing with other physicians who, of course, already have a limited amount of time. So the key things for talking with your emergency providers are clarity, brevity, and honesty. When you're interacting with them, talk about what brought you into the ER today and when those symptoms started. So for instance, if you've been having kind of cough and cold symptoms for a week, but today it got so bad you're short of breath and couldn't carry a conversation, that's important pieces of information for us to know. Sometimes I've seen it many times, a provider will go into a patient's room and say, so tell me what's going on with you. And the patient will start back all the way to the very beginning. Oh, somebody one time to go, well, when I was 4, I kept getting tonsillitis and they would put me on antibiotics and then I would get tonsillitis again and go on this very long story about getting their tonsils out, and they're in with symptoms of heart failure. So that's going to be very frustrating to your ER providers. So that already kind of sets up a bad dynamic for communication, but also that information just simply isn't necessary to a visit like this. When you're in the emergency department, we are laser focused on, again, screening and treating for that life-threatening illness or injury. And all the little extra things are kind of fall off the screen of what's important right now. So being very clear about today's problems and any conditions you have that are related to today's problems. For instance, for that patient who has been having cough, cold, and now shortness of breath symptoms, again, I'm not worried about having your tonsils out when you were 4, but if you have asthma or COPD, I need to know about that, because that makes your condition even more significant than somebody who doesn't have it. On that note, please also be open and honest about your substance use. We're not the police, and we're not going to call your mom. But if you smoke or use tobacco of any form, or a big one now that often we see skipped over is marijuana. It's becoming more prevalent as it becomes decriminalized. Alcohol use, and then other illegal street drugs. Again, we're not going to call anybody, but we need to know, because those drugs can cause interactions with potential treatments that we may need to be using for you that we need to be aware of, or also can just cause issues down the line with withdrawal, or can set you up for other conditions that maybe we weren't thinking about. But if we know where you're using these substances, it might be applicable to your clinical situation. So be open and honest in your communication. Be clear and brief about just what's going on with you right in this moment in time. And then always making sure that you are speaking in a respectful manner. Again, I've listed some of the reasons why you can have trouble with communication and perhaps a bad dynamic with your providers from the outset. So trying to avoid that as much as possible is going to get you the best experience. You catch more flies with honey than vinegar. And again, when you're sick or injured, it shouldn't fall on you to have to be the one who's tailoring your communication to be able to get the treatment that you deserve. But it just is unfortunately the situation. There is a high incidence of disrespect and even violence in the emergency department. And because of that, your emergency providers typically have a very low threshold for anything that does come across as disrespectful. So doing your best to remain calm and being respectful of their time and their expertise while still getting your needs across and advocating for yourself is going to be key for you. It's very difficult to balance when you are that sick patient. As much as you can, I suggest having a support person with you. If not, if you can, consider having a clinically trained independent patient advocate at your side. This is exactly the kind of stuff that I do so that my patients can focus on just being, trying to feel better and focusing on themselves and not have to figure out this communication dynamic to get all of their needs met. That is exactly what an advocate is for. So if that's something you're interested in, please reach out and I can tell you more about that. But always, when you are interacting with any aspect of the healthcare spectrum, particularly in the emergency department, have the confidence to stand up for yourself and respectfully ask questions and get a full understanding of what your condition is, particularly if you're being discharged and you don't feel like, you don't feel any better and you haven't gotten an answer. It's a really good time to ask those questions. There's a lot of times in the emergency department where you will leave and not have an answer to why you're feeling crummy. And that goes back again to the limitations of the emergency department. And I like to tell my patients, a lot of times you will come in and you won't get an answer to what's going on today, particularly if it's something that's been going on for a long time, because what we can screen for is emergent life-threatening conditions. So if you don't have something that is life-threatening, you may not get an answer today. So knowing that ahead of time, but then the advantage of still seeking that attention is helping you to feel better with medications and then getting you plugged in with the resources to ultimately get you moved to where you need to be. So I know that's a lot, but that's kind of a little bit of the overview of how you can get the best experience out of the ER. So let me know if you've tried some of these things, if you've tried them and not worked, if you've tried them and they have worked. Any questions you have and any kind of topics you'd like to see covered in the future, I'd love to hear from you. Drop it in the comments below. Thank you so much for coming out with me